Hi, I'm Valerie, a registered nurse and health educator specializing in wellness. Over the course of my career, I have worked in a couple different cardiology specialties, and more recently, I have helped many people improve their heart health as a health educator and coach. I also have a lot of videos on this channel about how to improve heart health, and I've even put together a heart health playlist. I'll put a link to that in the description for this video. I believe that it is important for anyone who has a heart to understand what can go wrong with it. Heart disease is the leading cause of death worldwide, and yet most people do not know what is really happening inside their heart when it is healthy or when disease starts to develop. People hear terms like high blood pressure, clogged arteries, or heart failure, but they do not always understand how those things actually affect the heart. The more you understand what is happening inside your heart, the more you can appreciate why healthy lifestyle choices matter so much for your heart and your longevity. And once you understand how these conditions develop, you can make better choices to protect your heart health. In this video, I am going to break it all down into simple terms, starting with how your heart works when it is healthy. Your heart is a strong, muscular pump about the size of your fist. It beats to move blood through every part of your body. It has 4 chambers that work together in a precise rhythm. 2 upper chambers called atria, which is plural for atrium, and 2 lower chambers called ventricles. The right side of your heart handles blood that has already delivered oxygen to your body. The right atrium collects this oxygen-depleted blood and passes it to the right ventricle, which then pumps it to your lungs. In the lungs, your blood picks up fresh oxygen and gets rid of carbon dioxide. That freshly oxygenated blood from the lungs then returns to the heart's left atrium, which passes it to the left ventricle. The left ventricle is the largest and strongest chamber in the heart. It needs to be because it pumps this oxygen-rich blood to every organ and tissue in your body. 4 valves, the mitral, aortic, tricuspid, and pulmonary valves, all act like one-way doors between these chambers. They open and close at just the right time to keep blood moving forward and prevent it from flowing backwards. Even a small problem with these valves can make your heart work much harder to pump the same amount of blood. Your heart also has its own electrical system, which works like a built-in pacemaker. A small group of cells in the upper right chamber, called the sinoatrial node, sends electrical signals that tell the heart when to contract. Those signals move through a pathway of fibers to the lower chambers, making sure that the top and bottom chambers work in perfect rhythm. That timing is critical. If the rhythm is too fast, too slow, unsynchronized, or irregular, blood does not move as well. And just like every other muscle in your body, the heart needs its own blood supply to stay alive. The coronary arteries wrap around the outside of the heart, delivering oxygen and nutrients directly to the heart muscle. If these arteries become narrowed or blocked, the heart muscle cannot get the fuel that it needs, which is when serious problems like chest pain or heart attacks can occur. When all of these systems work the way that they should, blood flows smoothly, oxygen reaches every tissue in your body, and your heart keeps up with whatever you are doing, whether you're sitting still or running at full speed. But when even one part of the system is damaged, whether that is in the arteries, the valves, the electrical system, or the heart muscle itself, that is when heart disease begins to develop. Heart disease is more than just one condition. Heart disease is actually a broader term for many different problems that affect how your heart and blood vessels work. It can involve the arteries that carry blood to the heart, the valves that keep blood flowing in the right direction, the electrical system that controls the heartbeat, or the heart muscle itself. These problems are often connected. High blood pressure, for example, forces the heart to work harder, which can cause the heart muscle to thicken and eventually lead to heart failure. Plaque buildup in the arteries can limit oxygen to the heart, causing chest pain or a heart attack. One thing that makes heart disease so dangerous is that it often develops quietly. Plaque can build up for years before causing symptoms, and conditions like high blood pressure can damage the heart long before you feel anything. Even mild irregular heart rhythms can progress to more serious electrical problems over time. Because every part of the heart works together, damage in one area often leads to problems in another. That is why it is important to understand the different types of heart disease and how they affect the heart. Heart disease can affect the heart in many different ways, and it often involves more than one part of the heart at the same time. One of the most common types is coronary artery disease, which happens when the arteries that supply the heart with oxygen-rich blood become narrow or blocked. This is caused by atherosclerosis, a buildup of cholesterol and fatty plaques along the artery walls. When the heart muscle cannot get enough oxygen, it can cause chest pain, also called angina. If a plaque breaks loose and completely blocks a coronary artery, it can cause a heart attack, which permanently damages the part of the heart muscle that is affected. Even when a heart attack does not occur, long-term oxygen deprivation can weaken the heart and eventually lead to heart failure. The valves of the heart can also develop problems. Valves can become stiff and too narrow to open fully, which is called stenosis, or too loose to close properly, which is called regurgitation. Both force the heart to work harder to move blood forward. Over time, this extra strain can enlarge and weaken the heart muscle, increase the risk of blood clots or infections, and eventually lead to heart failure. Another major type of heart disease involves the electrical system that controls the heartbeat. These rhythm problems, called arrhythmias, range from mild skip beats to dangerous conditions that can stop the heart from pumping effectively. Atrial fibrillation, the most common arrhythmia, causes chaotic contractions in the upper chambers and increases the risk of stroke. More dangerous rhythm disturbances like ventricular fibrillation are life-threatening emergencies. When someone is shocked, it is usually to convert them out of ventricular fibrillation. Cardiomyopathy is another condition that directly affects the heart muscle. It can become thickened, stiff, or enlarged, making it harder for the heart to pump enough blood to meet the body's needs. Cardiomyopathy can be caused by long-standing high blood pressure, heart muscle damage from heart attacks, valve disease, genetic conditions, or even long-term alcohol or drug use. Over time, it often progresses to heart failure or leads to arrhythmias. Some types of heart disease are caused by inflammation. Infections or autoimmune conditions can damage the heart in different ways. Endocarditis affects the inner lining of the heart and valves. Myocarditis affects the heart muscle, and pericarditis affects the sac that surrounds the heart. Even when these conditions are not chronic, they can leave permanent damage that increases the risk of other heart problems later on in life. Finally, some people are born with congenital heart defects. These are structural problems in the heart present from birth. These defects can range from mild to severe and may require surgery early in life. Even after treatment, people with congenital heart defects are more likely to develop other types of heart disease as they get older. And while not technically a form of heart disease, high blood pressure, also called hypertension, plays a major role in nearly all of these conditions, so I feel like I have to mention it. High blood pressure forces the heart to work harder with every beat, which can thicken and stiffen the heart muscle over time. It also damages the arteries, increases the risk of atherosclerosis, increases the risk of coronary artery disease, heart failure, and stroke. Because of its widespread impact, controlling blood pressure is one of the most important ways to protect your heart. One of the biggest challenges with heart disease is that one problem often leads to another. Damage in one part of the heart can set off a chain reaction that affects the entire system. A heart attack, for example, happens when a blocked coronary artery cuts off oxygen in the part of the heart muscle. That damaged muscle can't pump as effectively, which increases the risk of heart failure and dangerous arrhythmias later on. A weakened heart, whether from coronary artery disease, valve problems, or cardiomyopathy, can eventually lead to congestive heart failure. In heart failure, the heart can't pump enough blood to meet the body's needs, which causes fluid to build up in the lungs and makes breathing difficult. Heart disease also raises the risk of stroke. Atrial fibrillation and other arrhythmias can cause blood to pool and form clots, which can travel to the brain and block blood flow. Also, if someone has narrowing of the heart arteries, they are also more likely to see narrowing in the blood vessels that feed the brain. Another serious complication is pulmonary hypertension, or high blood pressure in the lungs. It is often caused by valve problems, coronary artery disease, or heart failure. Pulmonary hypertension strains the right side of the heart and can eventually lead to right-sided heart failure. These complications are why managing heart disease, and even more importantly, preventing it, is so critical. The earlier that you take steps to protect your heart, the better your chances of avoiding these serious outcomes. Understanding what heart disease is and how it develops can help you take better care of your heart, whether you are trying to prevent problems or if you are already living with heart disease. When you understand what is happening inside your heart, things like blood pressure, cholesterol, and lifestyle changes are not just numbers or medical jargon. They are directly connected to how well your heart can keep doing its job. Heart disease often develops quietly, with changes happening long before symptoms appear. Plaque builds up in arteries over years, and high blood pressure can silently strain the heart until it becomes weaker. Knowing this helps you take even small changes seriously because they can make a big difference over time. If you already have heart disease, understanding how it progresses can help you recognize warning signs sooner and work with your doctor to manage it before complications develop. And if you don't have heart disease, this information can be a good reminder how daily habits are directly connected to your long-term wellness through the health of your heart. The more you understand, the more control you have over your heart health, no matter where you are starting from. Heart disease may sound complicated, but when you know what is actually happening inside your heart, you can make better choices to protect it or manage it if you are already living with heart disease. Small daily decisions like staying more active, eating heart-healthy foods, and keeping your blood pressure under control add up more than most people realize. And if you already have heart disease, lifestyle can still make a big difference in how fast it will progress or if it will progress at all. Staying informed also helps you recognize changes early and work with your doctor to prevent complications. Your heart works for you every second of every day. Taking the time to understand how to care for it is one of the best investments that you can make in your health and your future. If you found this video helpful, please give the video a like, share it with someone who could benefit, and check out my heart health playlist. I will link to it in the description below. And don't forget to subscribe to my channel for more science-based wellness information. Thank you so much for watching, and as always, please take good care of yourself.